Good afternoon and welcome to the City Club of Eugene's February 21st, 2025 program, New Behavioral Health Facilities in Lane County. My name is Andrew Calick and I'm City Club's president. We're coming to you from our home at the historic Wow Hall in the heart of downtown Eugene, and it's my pleasure to extend a warm welcome to our speakers and to all of you joining us here in person, online, and over the radio. Since 1990, City Club has been dedicated to our founding mission to build community vision through open inquiry. In accordance with our mission and purpose, we hope to help connect people throughout our community and across generations, identities, experiences, and perspectives. You are invited this week and every week to join us in this effort, to share your wisdom, learn something new, and to take active steps to make a difference in this city and region that we love. We cannot do this work alone, so a special thank you today to our Platinum, Community, and Diamond sponsors. The Eugene Area Chamber of Commerce, serving as a catalytic leader in creating a vibrant and diverse economy that drives economic opportunity and well-being. Kaiser Permanente, which exists to provide high-quality, affordable healthcare services and to improve the health of our members and the communities we serve. More information at www.kp.org. The University of Oregon has helped Oregonians question critically, think logically, reason effectively, communicate clearly, act creatively, and live ethically since 1876. More information at uoregon.edu. Lane Community College transforms lives through learning. LCC provides comprehensive, accessible, high-quality educational opportunities that promote student success. For more information, visit lanecc.edu. And thank you to the City of Eugene and to Lane County for their support as well. With that, I'll hand it over to Alyssa Gilbert, the City Club board member and the coordinator of today's program. Alyssa.
Thanks, Andrew. There is a mental health crisis in Lane County without enough services to handle it. This shortage affects all of us. Though not everyone experiences a significant mental health or substance abuse condition, most of us know and love someone who does. Recently, Peace Health, in partnership with Lane County, announced its plan to build and operate a new inpatient behavioral health hospital in Lane County. The 96-bed freestanding facility will be named Timber Springs Behavioral Health Hospital and will be located near Peace Health Sacred Heart Medical Center at Riverbend in Springfield. The hospital will provide inpatient behavioral health services for adolescent, adult, and geriatric patients, as well as intensive outpatient treatment. In a private-public partnership, the facility will be constructed next to the planned Lane County Crisis Stabilization Center. The Stabilization Center will provide behavioral health urgent care and emergency care for people who need it when they need it, filling a critical gap in our community. Together, these facilities will offer critical access to a growing collection of behavioral health resources in the community. Today's forum is going to cover both of these facilities and their intended impact on our community. Our first speaker today is going to be Alicia Bamer, Chief Administrative Officer at Peace Health. Alicia owns more than 25 years of varied experience serving Lane County with a demonstrated record of bringing stakeholders together to improve healthcare access to all. Our next speaker will be Eve Gray, Director of Lane County Health and Human Services. Eve helps guide the organization's 8 divisions and 850 staff on a mission-based approach to helping the most underserved in Lane County access vital services. She has over a decade of healthcare experience, including roles in quality, patient safety, and operational leadership in both inpatient and outpatient settings. Without further ado, I'd like to welcome up Alicia Bamer.
Great, good afternoon. I'm Alicia Beamer, and I was just reflecting on the 25 years of experience. I've aged myself there, but prior to that, I grew up here in Lane County. I graduated from South Eugene High School, went to school at LCC, UVO, and Bushnell now, and a little nervous being here in this Wow Hall because as growing up I was a grunge kid, so totally different feel here. So thank you, but very much thank you very much for joining us today to talk about this important topic. So it's my pleasure and to be speaking with Director Eve Gray here. She'll be presenting after me about our public-private partnership involving a behavioral health campus model. And that model is really, our focus is increasing behavioral health services in this community 24/7. And for Peace Health's portion of that, it will involve a 96-bed inpatient psychiatric hospital, Timber Springs, that will also include in those 96 beds a 24-bed adolescent psychiatric unit and additional adult beds, including those for seniors. Oregon ranks amongst the highest, or amongst the lowest in the nation for access to behavioral health services. And Lane County ranks one of the highest in the state for prevalence of mental illness. And mental health and mental illness varies in how it impacts an individual, from no impairment to mild, moderate, or even severe impairment that can limit a major life activities. NAMI, the National Alliance for Mental Illness, reports that about 1 in 5 adults and 1 in 6 adolescents experience a mental health condition in their lifetime. And it takes about 11 years between the initial symptom onset to time of treatment. To put that into perspective, that means about 70,000 individuals in Lane County are or have experienced a mental health condition. And if we compare this to other diseases, the American Heart Association reports 1 in 5 adults have high blood pressure, 1 in 10 experience high cholesterol, and 1 in 10 individuals experience diabetes. An additional stat is that there is a silver lining, if we can find one, from COVID, and that is that the substance abuse and mental health services report that 1 in 3 adolescents received mental health services in 2022. This demonstrates hope that seeking care for mental illness can be normalized for our next generation. And when we look back at those statistics in 2022, the CDC reported that suicide rates that year for adolescents had gone down. So there is hope in the future. I had the opportunity to visit and tour both of the facilities that we're talking to you about and models of care in other states. And I walked away with an overwhelming sense of hope for our community. I saw a viable pathway forward in reducing the profound loss that we're experiencing in Lane County. And loss is personal for everybody, but for me, that means the tragic loss of lives due to suicide, the loss of precious time with those we care about while one of us is grappling with mental health symptoms, the loss of our healthcare workforce stemming from the moral distress experienced due to inadequate resources, and the loss of loved ones who find themselves incarcerated due to actions taken while struggling with a mental illness. While these facilities may not address every aspect of these losses or the losses that others in our community are experiencing, they represent a significant step forward in bridging the gaps in our support systems. If we also look at studies, we know that individuals who have a serious mental illness or serious mental illness, they also are 40% higher for having rates of developing cardiac disease, stroke, and diabetes. And so that's where Peace Health, we really looked internally at what we are providing as well. And for Peace Health and how we integrate with overall care, health, and wellness, our Peace Health Medical Group, it serves over 600,000 patients a year. And we are really proud to have behavioral health providers embedded in our primary care programs. We also have hospitals, one in Peace Harbor in Florence and one in Cottage Grove Community Medical Center. They both provide care for over 1,200 inpatients per year and close to 30,000 visits. And then looking internally at Riverbend, we're a trauma level 2 hospital. We're the largest between Portland and San Francisco. We average about 77,000 emergency department visits a year and 23,000 inpatients a year. We have been nationally recognized for high quality for surgical care, stroke, cardiology, heart and vascular services, and inpatient rehab, and really looking at behavioral health services and how that, as we expand and extend those services, how it will also complement those services provided already in our facilities. And Riverbend is dedicated, we've dedicated actually our last shelled space as we continue to expand services. And we're super excited. By 2028, we'll be adding close to 190 inpatient beds, non-beds total to the area. And that includes the construction that's already undergoing at Riverbend, as well as we're breaking ground next month on a 42-bed inpatient rehab facility. So that involves physical rehab, and that will be open in 2026, and then these additional 96 inpatient psychiatric beds. We also offer a really robust and comprehensive behavioral health services that goes back to 1969, when we opened the inpatient behavioral health unit, the Johnson unit, which is named after a pioneering Sacred Heart psychiatrist. In 2014, just knowing and recognizing the needs that the need for additional inpatient psychiatric care, we opened a larger inpatient unit, and we plan to remain at University District, and our plan is to keep that unit open until Timber Springs opens. We also have a robust behavioral health program, outpatient program, that involves crisis services through all of our emergency departments, outpatient counseling and psychiatry, peer support, intensive outpatient and partial hospitalization, and our certified community behavioral health clinic. And all of those programs will really, again, complement both the behavioral health campus model that we're striving to achieve. Additionally, one of the things that we're super proud of, and I see folks here in the community right now, we have really great community partners here in Lane County. And through our community benefit program, we are proud to partner with programs that support timely access of care for the right place in the right amount of time, and really in a compassionate way. Some of those services include youth organizations that provide support to at-risk youth, such as Looking Glass, 15th Night Hosea Youth. We also partner with multiple organizations who help the most vulnerable in our community, such as Volunteers in Medicine, Catholic Community Health Services, HIV Alliance, South Lane Mental Health. These are just a few of the many that through our community benefit program that we partner with. But really, as we look at this behavioral health campus model, it will really help set a strong foundation for the success of this model. As we imagined a comprehensive and integrated crisis network in Lane County that saves lives by offering in-the-moment access to behavioral health services and to individuals of all ages and demographics who need them the most, it was clear this public-private partnership with Lane County to provide a behavioral health campus model aligned with Peace Health's core mission and values. We envisioned having a resource available 24/7 for mental health and substance use care, meeting everyone's needs. And that means patients who are in need of having their medications refilled or in need of inpatient psychiatric care for behavioral health. And instead of taking a loved one experiencing a behavioral health crisis to a crowded emergency department where they might feel overwhelmed or leave before they're treated, we imagine them being welcomed into a trauma-informed and soothing environment, which would be the Lane Stabilization Center. Here they would receive immediate attention and support, fostering safety and hope. And I don't know, for those of you in the audience, and you don't have to raise your hand, but imagine with me, or think about a time where maybe you went to an emergency department and you stayed for 4 or 8 hours. And if you've ever done that, it probably felt like much longer than 4 or 8 hours. So imagine with me what we experience in our emergency departments every week is having at least 4 adolescents a week who board in our emergency departments for at least a week or even longer as they're waiting for an inpatient psychiatric bed. So as we pictured this model of care, we really looked at what it would look like instead for parents to bring a youth or an adolescent to a calming environment, the Lane Stabilization Center, and then be transferred directly into an inpatient adolescent psychiatric bed. This will allow them and their families to remain in the area and receive treatment and ensure they are connected to local resources upon discharge. Additionally, as we imagined easing the pressure on our emergency departments, as individuals, law enforcement, and mobile crisis units instead utilize the Lane Stabilization Center, which we know will be much better suited for individuals, for these patients. An added bonus of opening the Lane Stabilization Center and Timber Springs is it allows for patients presenting to the emergency department for medical treatment, such as broken bones, respiratory illness, or lacerations, or all of the things that are medical treatment, they will also receive care more quickly and efficiently. And by fostering collaboration with Lane County, we look forward to being able to maximize the impact of our limited resources and transform the challenges we expect to face through the project. And some of those, and Director Gray may also be talking about them, are sustainable reimbursement for both projects. For us, for the inpatient for the inpatient psychiatric hospital, we have to go through a robust certificate of need process, which takes about a year. We're also it's been really a great joy to work with Lane County in collaboration in developing our workforce and our behavioral health workforce. We began this the minute we started this project, knowing we have 3 years to really work on this and make sure that we have the workforce available when we open those doors, and other key areas. So truly, this project's true to our Peace Health mission and values, and we're really looking forward to working with Lane County to bring hope, healing, and wellness to the community. Thank you.
Hello, I'm Eve Gray, Director of Health and Human Services for Lane County. And I am here to basically pick up where Alicia left off and describe in a little more detail during the time I have with you today what a stabilization center is and why we need one. I think that there's more clarity largely in folks' minds around what a hospital is and why you would need a hospital. A stabilization center is a much newer concept nationally, and we will be bringing a model that is the first of its kind in the state of Oregon, though this model exists in other states, Arizona being the first that implemented it. In this process, what we have recognized is that partnership is essential. We are not going to address the problems, the healthcare shortages that we have in our communities with the public sector alone, and we're not going to do it with the private sector alone. We all have to figure out how to work together, how to develop partnerships in order to bring these really big projects to fruition. So we are partnering in this work not only with Peace Health in co-locating our facilities on the same campus, but also our provider for the stabilization center is Connections Health Solutions. And they run these stabilization centers in other places in the country. I mentioned Arizona. They also have one in Washington and one on the East Coast as well. And so we have models to work from. We also know that about a month ago, the Substance Abuse Mental Health Services Administration, or SAMHSA, published guidelines around stabilization centers and what they recommend nationally. Those were very heavily influenced by Connections Health Solutions. So the model that we are bringing into our community is being seen as the national standard for how we do crisis response in the United States going forward. So let me talk a little bit about what the situation is today. Today, when someone has a mental health problem or a substance abuse problem, often, ideally, the first thing that we try to do is go to primary care. And primary care may feel comfortable working with us if we have a mild level of illness. Maybe we're referred to a therapist in the community. We may or may not be able to get in timely. And the thing about behavioral health is that there are windows of opportunity, kind of windows of readiness. Now, that's the case with a number of chronic health conditions where we say, you know what, it's fine, I'm fine, I'm fine. And then there's a moment where we say, you know what, I'm not fine, and I think I'm ready for treatment. And if we don't get someone treatment right in that moment, often the window closes. And we go back to saying, you know what, I'm fine. I made it through that, I'm fine. So that's a cycle that we go in, and Alicia mentioned how long it takes from the time symptoms start to get treatment. Much of this is that in those windows of opportunity that we have, we aren't able to get into care, and then the window closes, and we move on. So when we're talking about, and just a quick definition, I'll be referring to behavioral health in this presentation. That is both mental health and substance abuse conditions combined, our behavioral health. And our stabilization center will be competent in the care of both sets of conditions. So I want to make sure that that's clear just in terms of the language I'm using. But we want to have a place where in the window of readiness, someone can access care right away. So that is part of what the stabilization center will be. The other part of what the stabilization center will be is in creating a different pathway for people who maybe didn't get the early access to care that they needed, or they've had a crisis in their life that has caused them to go from very stable to very unstable in their behavioral health condition. And they find themselves in a state of crisis. Now, the crisis is defined as your own perception or the perception of people around you that you have an inability to cope in this moment. And there are lots of different ways that crisis can present itself, depending on whom the individual is and what specifically is going on with them. But when someone is in a state of crisis, what they need is immediate, high-level access to treatment. So today, when someone's in a state of crisis, we do have some wonderful pathways in our community in terms of mobile crisis response, which is a wonderful alternative. We also have crisis lines and access to 988. These are all wonderful alternatives to going somewhere. If you can have your crisis de-escalated, we find that about 70% of people in crisis can be de-escalated by phone. And it is important to use that as the first resource. If that's not possible, we can send mobile crisis. But what if mobile crisis cannot resolve that situation? There are two options today. The individual can be brought to the emergency department, where there are very skilled and talented clinicians, but they're not behavioral health specialists. And we all know when we've gone to the emergency department, it is the emergency room doctor's job to decide, do we have an immediately life-threatening condition? And if not, generally, we're either going to be discharged or we're going to be sent to a specialist. And we're going to wait for an evaluation. When someone's in behavioral health crisis, waiting for an evaluation, especially in a bright, crowded, sometimes loud environment like an emergency department, is very, very triggering. So that can actually cause the person's condition to worsen rather than get better. So what we need instead of an emergency department is a place where people can go and receive immediate access to behavioral health evaluation and specialist care. The other avenue, if someone doesn't go to the emergency department, is that police may respond and identify that the individual is engaging in behavior that, even if due to their behavioral health condition, is a crime. So these are things like disorderly conduct, might be things like trespassing, something that is generally, we're not talking about folks who are engaging in violent crimes. Those individuals will still continue to follow a criminal pathway. And we have a wonderful sheriff's office who works really hard to also provide behavioral health services in the jail when we have someone who becomes violent and harms someone else. But when we have someone who's in a crisis circumstance and we don't really, and the police are looking at this and saying, this person doesn't need to go to jail. What they need is treatment. That's another opportunity for the Stabilization Center, where we can keep people out of jail, even if they were committing a low-level crime, because it is the assessment of law enforcement that that behavior was related to a mental health or substance abuse condition, and that getting access to treatment is really what that person needs. So this is essentially what the Stabilization Center is about. And we'll have a number of different levels of care within the Stabilization Center. We will also take care of, at this point we're saying all ages, though we do believe that there will be some regulatory requirements that will force us to set a minimum age. But we will take care of kids and adolescents, as well as adults throughout the lifespan. And we'll have multiple levels of care. So we will have what I believe is the only 24-hour urgent care in our area. Most urgent cares, of course, close around 8 p.m., and many of us have experienced going in at 7 and being told, we are full. We don't want that for folks who really need behavioral health care. We're going to have 24-hour access. If someone, if they're new to town and it's the weekend and they need a medication refill and they can't get a hold of their doctor, or maybe they haven't been able to establish care here, or maybe someone's had a loss in their lives and they wake up at midnight and they're in a moment where they just don't know what to do because the grief is so, the feeling of grief is so strong at that moment. There will be a place that they can go in order to help them pull the pieces together and figure out next steps. So that's the urgent care side, which we will have for adults and for youth. They'll be separate entrances. We don't mix adults and youth, but it will be on the same campus. Now, for folks who need more than just a visit in urgent care, the next level of care that we'll have is what's called an observation unit. Now, for regulatory reasons, people can stay in an observation unit for 23 hours, 59 minutes, and 59 seconds. And at that point, you have to move to a different level of care. But what we find is that of the people who need an observation unit, which often would be people who qualify for needing inpatient level of care, still, most of them can be stabilized within 24 hours in the stabilization centers that exist elsewhere in the country. And of those who are brought in by law enforcement, maybe against their will, 60% can be converted from an involuntary status to voluntary care. And why is that? It's because it's a trauma-informed environment. You are greeted first by peers when you walk in the door who have been there, who know what this experience is like, who welcome you, who want you there. And this type of interaction and environment flips the script for people who have had negative experiences with treatment in the past. And that's why they say, I don't want that anymore. These stabilization centers can change that model so that individuals are saying, you know what, this isn't so bad because it's the right treatment and the right level of care for me. Now, not everyone can be stabilized in 23 hours and 59 minutes. So for those who can't, our stabilization center will have some beds and be able to keep people up to 5 days. Again, most people will be able to be treated and safely discharged within that time window of 5 days. And for those who can't, Timber Springs will be right next door. and we can make sure to get someone safely over to the inpatient unit for definitive treatment. And the models are a little bit different between adults and youth. So with adults, our observation unit is a set of recliners, which sounds kind of weird. You know, you're in the middle of a big room and a bunch of recliners, but actually what we find is that people who are in behavioral health crisis do better when they're not alone, when they can talk with one another, people who are having similar experiences, where they can normalize what's happening to them and they're not in a room by themselves. It also has a safety component where we can monitor and make sure that the environment is staying safe and calm. For youth, it's a little bit different because when you're treating a young person, you're not just treating that person, you're treating a whole family. So we'll have individual rooms that youth can go in from the beginning, from observation, as long as they need to stay, where we're treating the youth, but then also recognizing that often the youth are ready to go before their families are ready. So taking the time to work with the family around comfort with a plan for how everyone's going to be safe and how the family's going to reintegrate together into the community. The Stabilization Center model also has comprehensive discharge planning from the moment someone is admitted. People are not, in the emergency department, the model is take someone, treat them, either admit or discharge to the street. In the Stabilization Center, and actually that's true in jail too, that people are released to the street. For the Stabilization Center, we will be identifying a destination for every individual. We will provide transportation to get them there so that we have follow-up and connection. And folks who can't get into treatment right away, once they're discharged, can come back to our urgent care and continue to receive ongoing outpatient treatment until the point that they get connected to services within the community. So we're very, very excited about this model. It has great promise to provide, it won't solve every problem with limited access to behavioral health care in our community. So I don't want to overpromise, but it will fill a critical gap and a critical need for people at every level of need related to a behavioral health condition. And we are so excited to be able to be sharing and socializing this model with our community right now so that all of you can get excited with us. So that's my introduction. And I should also put a plug in, we do have a website. You can keep track and get updates on our project. It is lanecounty.org/stabilization center. So you're welcome to check it out and keep track of this project. So thanks so much.
Thank you both very much. We will begin our question and answer in just a moment, but first, a special thank you to our award-winning public radio station, KLCC FM 89.7, for airing City Club programs Mondays at 7 p.m. For those listening at home or in the car right now, your household is one of several thousand tuning into City Club on KLCC, and we love that you're here. You can also find all recent City Club programs archived on KLCC, as well as on our YouTube channel and as podcasts. We will take a brief break, and then we'll be back for questions. Thank you. All right, guys. We take a breath.
I'd like to welcome everyone back from our break so we can go ahead and get started with the Q&A. And I will let Joel ask the first question.
Joel Curran, City Club member. That's hard to believe. Joel Curran, City Club member for 12 years. Simple question. When do you expect these two facilities to be up and running? Yeah,
In about 2028,
okay.
it'll take about 3 years to go through all the complexities for both of us, actually.
Okay, thank you.
Yeah, nothing. Easy question.
We did get a question from the online live stream, so I'll go ahead and ask that one. It is from Samuel Rutledge. Will the Crisis Center be able to treat patients who are on a hold awaiting commitment proceedings, or will it be only for patients who have signed themselves in?
Good question, thank you. This model of stabilization center that we are bringing to Lane County can treat everyone of every level of what we call acuity. So acuity is a medical term for severity of illness. That means that individuals who qualify for a hold because they are an imminent danger to themselves or others will be able to receive care in the stabilization center. But as I mentioned, we will be able to convert about 60% of those folks to voluntary status. The remainder would continue to undergo the process toward commitment and would likely head toward Timber Springs for their next phase of care.
You want to go ahead and ask the next question?
Jerry Morcello. Apologies, but this may be a negative. Johnson Center and the old hospital, of course, were near the campus and downtown, but now we will have instead a facility way out in the country, so to speak. Lane Transit does service it, but do you see this as a negative, and how will it be addressed?
So I can speak to this on the side of the stabilization center, and then I will give it over to Alicia to speak related to the hospital. For the Lane Stabilization Center, we had a set of criteria for where we would site this facility. And key for us geographically was that we were within 30 minutes of 90% of Lane County residents, because it is very important that we are serving all communities of Lane County. Being right along the I-5 corridor is really helpful in meeting that goal. So it is out of the Eugene City core, but it is more accessible to kind of a broader range of geographic areas within our community.
Yeah, and Eve said that really well. We also see it from the inpatient psychiatric hospital perspective. The location, again, this will be a regional hospital. Adolescents and youth that will be coming to the facility will likely be coming from around the state. There's only 2 adolescent psychiatric hospitals in Portland, so we will likely be bringing patients from south or even east or west of us. So that location right off of the I-5 corridor will be really nice for families that are coming in to see their loved ones and patients, as well as having the inpatient psychiatric hospital and the crisis stabilization center so close to the Riverbend Emergency Department is also another bonus to having it over there. Thank you for the question.
Next question.
Andrew Kallock, you mentioned the infrastructure of these two facilities. You touched briefly on workforce, and I want you to maybe tell us a little bit more about the efforts that you've been undergoing, because we have had, say, folks from the Ballmer Institute here talking about the shortage of clinicians in various ways. And so what have you done to solve that problem, and what barriers to finding that workforce exist here in Lane County that you've been trying to solve? Thanks.
No, love that question. Thank you. This is something that we started with Lane County working on even just last spring, knowing that this was coming. One of the things that we recognized as we looked at the workforce is that there is a significant need now, and even as we look into the future with next generations of the workforce, how do we build that and bring more workforce and build up here locally for behavioral health as well as healthcare in general. So in the spring, we started bringing together different colleges, universities, including the Ballmer Institute, and also our community partners who provide behavioral health services from around Lane County. One of the issues that we experience in behavioral health specifically is that when an organization, whether it's Peace Health or not Peace Health, or the Lane County or other organizations that provide behavioral health services, if the wages go up or there's a difference in a different model of staffing for folks, then the behavioral health workforce may leave and go to the other higher paying job. And we've seen some gaps there, and we're competing against each other, and we really want to stop doing that. We want to work together and build the workforce so none of us are experiencing those gaps, because each different organization provides that specialized care. So we started from that lens, is how do we work together and how do we work with the colleges and communities. And then we're continuing to meet regularly to build that. The other part, from a Peace Health perspective, we've been very blessed to work with Bushnell and LCC in building our nursing workforce and being really creative with them. We're bringing in, depending on the cohort, due to partnerships that we have with LCC and Bushnell, between 8 to 30 new nurses through that. And then we just partnered with Bushnell for nursing for their facilitators and leaders, so that we can, educators, so that we can also build the workforce there.
Thank you. And on the side of kind of the pure behavioral health clinicians, there are a number of efforts that have been underway. So apprenticeship is a hot topic in the behavioral health workforce arena. We have apprenticeships for certified alcohol and drug counselors at the county. And this, the great thing about apprenticeships is that it decreases the barrier of having to stop working in order to go to school and get a credential, and then lose that income while you're having to pay tuition. This is an insurmountable barrier for many people, particularly those from backgrounds of poverty, or who might be single parents, or folks that we would really like within our workforce, but just don't see the future or the reality of getting the credentials that are needed. We also have access to a qualified mental health associate apprenticeship. Those exist within the state. We haven't done that yet as Lane County, because we've been okay on recruiting that particular type of clinician, but we will be recruiting that level within the Stabilization Center and are going to look at efforts there. Lane Community College also just launched a program to provide the credentials for a qualified mental health associate. In the past, this has been a bachelor's degree, but the state provided authorization for community colleges who have the right curriculum to be able to prepare workforce at the associate's level. And potentially, LCC now has the ability to provide some bachelor's degrees. They're starting to get into that space, and we look forward to seeing the direction that goes from producing that part of the workforce. Master's level clinicians have been hardest for us to recruit, and a lot of this is, again, it's a lot of money to pay to go to school. You have to take 2 years off in order to do it, of working, and then the wages are not nearly what the wages are for other master's level healthcare clinicians, like nurse practitioners and physician associates. So we are working with the legislature. There are some bills that would provide tuition assistance, additional options for loan repayment, as well as working through apprenticeships within the qualified mental health professional, so that's the master's level clinician level, so that individuals could work for an organization like mine, could be employed, have a wage, and have their master's degree covered, and we would be providing the internships that are required in order for them to achieve that master's level of education. So lots of efforts to reduce the barriers to entry, and then we have to continue to work on reimbursement rates for behavioral health care. It's just, in my mind, not acceptable that a behavioral health clinician is receiving half to 60% of what a physical health clinician is receiving for a full day's work. So we have to continue that process of saying that part of parity between, or sameness in how we cover mental health versus physical health, has to be in those reimbursement rates as well.
Next question.
Yes, Dr. Dan Ballin, I have two questions. First, how much is this going to cost to build and maintain a year? And second, if President Trump and the current government repeals the ACA and behavioral health is no longer covered, how will you fund this?
Thank you. So the current cost estimate for the stabilization center is about $30 million for the build, of which we've raised just over half, and we are seeking support within our legislature to help us close that gap. And then in terms of, and operating costs, you asked, somewhere in the neighborhood of $8 million a year, and we are still working on the reimbursement pathways for all of the different levels of care in order to maintain those operations. So continue in partnership with the state on that. And in terms of the direction related to Medicaid and Medicaid coverage, Medicaid is a program that is funded by both the federal government and the state government. So the federal government does set some rules around the types of things types of services that you can provide. I haven't yet seen any proposal that would remove behavioral health care as something that is covered by Medicaid. Certainly, if fewer people have health care coverage, that does impact the kind of the business model of the entire healthcare community, because you have a greater number of people who are uninsured and accessing care without the ability to pay, a greater number of people who face medical bankruptcy and potentially homelessness as a result of that bankruptcy related to those medical bills. So there are lots of things that are not good about people being uninsured, and we know that. At this point, it's watchful waiting. We don't know. There are a number of proposals that have been put on the table, none of which have any real action taken on them yet. So we're trying to not be overly anxious, because a lot of times what the actual proposal is that will come out of these types of conversations won't be as bad as we thought it might be. But again, we will continue monitoring. And the state also, the Oregon Health Authority, has a website where you can go and check what they have to say about how any federal changes are impacting programs that are funded by the state. And they would be the ones to kind of identify where any changes to Medicaid were ultimately impacting patient care, because there's an intermediate step where the state has to look and say, okay, if the federal government isn't going to pay for this, are we going to pay for this? And only if the state says, no, we don't have the funds to pay for that, would services be impacted.
No, I think as far as costs, so we're still evaluating. Part of what will happen when part of it's the discernment that the county's doing for the property. Once the property is, once that discernment and the purchase is completed, then we will submit what we call a letter of intent for the inpatient facility, and at that point, we will really look at what is the cost in the moment, to points that Eve's talking about, as far as there's a lot of things we're evaluating right now, right, with inflation and reimbursement. So we'll have all of that ready when we issue the letter of intent. But thank you for the question.
Next question.
First of all, thank you for being here. This is valuable information for us. I'm kind of dovetailing on the other question, though. Do you rely on federal grants?
So for this program, not grants, but we definitely rely on government payers. So to Medicaid and Medicare are big payers. And in this community, for inpatient psychiatric treatment, it's about 78 to 80%, depending. So yes.
Okay.
And then
Your answer was perfect.
Come on up.
Hi, I'm Sue Walling. I'm curious about the interaction between drug and alcohol abuse and behavioral health. I mean, obviously, there's a lot of overlap, and I've often wondered which came first, but that's sort of immaterial, I guess. But when someone comes in their crisis is that they're intoxicated on whatever. I used to work in the ICU, and we would have people in the hospital for days just getting them through withdrawal or whatever. And then even then, there's a shortage of treatment facilities if they are willing to go through treatment. How does that interplay? It seems like that just getting them off of whatever they came in on would take up most of your crisis stabilization time, and then where do they go from there?
Sure. So someone who's as sick as you're talking about in terms of needing an ICU level of care will still need an ICU level of care. The stabilization center won't prevent folks from going to the hospital when they have a medical need that requires that level of care. We will provide sobering services. So folks who require basic medical monitoring, who just need to come down from whatever substance they're on, would be the type of service that we would provide. And yes, getting folks into treatment in the community can be really, really challenging. Outpatient treatment is a lot easier to access than what we call inpatient treatment or residential treatment, where someone doesn't go home at night. So those facilities are all a part of the state's plans to be expanding access to behavioral health care, with a recognition that we have a much higher need related to the number of substance abuse residential facilities than we do any other type of facility. So it's all interconnected, and it goes back to the point that this facility can't solve every problem with access to behavioral health care, but as we see growth in those other residential capacities, folks will be connected to that from the stabilization center if they don't require a hospital level of care.
And I would add, so Timber Springs we're really excited as well, because part of what we don't offer, or we can't, what we're doing right now is sending quite a few individuals who have co-occurring diagnoses, so substance abuse and mental illness. A number of those adults right now are going up to Portland for that level of care. So one of the things that we'll be offering at Timber Springs for those adults is that treatment here locally, so they can stay here. So as they're transitioning out of the ICU, they can go to the unit just down the street. Thanks.
Next question.
Andrew Kalik again. You mentioned that when youth come in, it's often you're serving an entire family. I imagine there's some cohort of youth that come in without their family. Can you talk a little bit about what share that is and sort of what challenges that presents in terms of insurance or otherwise? Thanks.
Well, I can talk to you from the emergency department. When we have a youth or adolescent that's presenting to our emergency department for that treatment without family, we treat them the same way we would with a family. Oftentimes they're supported by DHS, and so we're working out with whatever agency is also advocating on behalf of that youth and supporting that youth. And really, again, it's about getting that adolescent and youth to the right level of care and working with the agency to make sure that can happen as soon as possible. Unfortunately, the reality right now is those kids are boarding in our emergency department for days, as I shared with you, because of the lack of resources.
One more question for me.
Great.
You mentioned that Oregon has worse numbers than the national average, and Lane County has worse numbers than the Oregon average. Why?
It's a big question. Yeah, I mean, I think it's, the services, and it's not, I will say from my perspective, it's not despite folks not trying really hard to make it better. And I think there's a lot of legislative opportunities, especially this session, to make it better. And also our governor's really focusing on that right now. These type of partnerships, COVID brought awareness and really brought us all together as a community in a way that we hadn't been before. And so I think that's going to help and make things better. I don't have all the answers for why, but I do see, as I shared, there's hope, especially as we're collaborating and we have these visions and just really making them possible. And I also think from a perspective in Oregon, bringing expertise such as Connections, who has been really acknowledged internationally as having the evidence-based model for care. We're bringing them into this state instead of really trying to do that on our own. And so and also the same thing for Peace Health, as we're bringing in LifePoint as a joint venture who is specializing in providing these services nationally. They can help us kind of help us step up our game so we can better serve our community.
Thank you.
Yeah, and I think what I would add to that is just Oregon, after deinstitutionalization, because years ago, we institutionalized a lot more people, and there were a lot of bad things that happened. And as a result of those bad things that happened, people were taken out of institutions with the promise and with the hope that we were going to fund the types of treatments that we need in a community in order to keep people healthy and safe in the community. And it was that second piece, that investment in the community resources, that never happened. And so what happened? People came, they have severe disabilities in many circumstances related to a behavioral health condition, and they're relegated to the streets because we don't have the resources to be able to make sure that we're providing appropriate treatment for people. So that's a great wrong that we are needing to right in our society, that the idea that not investing deeply in behavioral health services and treatment would lead to a better outcome than institutionalization, obviously that didn't work. So we are way behind the 8 ball in our investment in behavioral health in the state of Oregon, but we do have a supportive governor, we have a supportive legislature to really try to right that and get ourselves back on track. It's gonna be really expensive because we are in really deep with not investing, not doing the preventative work, not keeping people healthy, allowing them to get as sick as so many people in our community have gotten. So that is, it's maybe not hopeful, hopeful for the future perhaps, but I think the reality of where we are.
Thank you very much.
Hi, Mary Layton, City Club member. So what you just said reminded me of the question that's been kind of on my mind a lot lately, which is Whitebird. Whitebird was serving all these people who were basically dropping in off the street, providing mail service, for giving them food, and its contract got cut quite a lot, and now there's a bunch of unemployed people who used to be really good at helping people who needed that kind of help off the top of their heads. And is there nothing we can do to integrate our values and our priorities and our resources better so that kind of thing doesn't happen? Now we have one organization which is basically homeless itself, operating out of First Christian's parking lot, and just fragments of the old organization operating out of the old house. What did we do wrong? What do we need to fix so that kind of stuff doesn't happen with quite so little planning?
That's a great question that I don't think I can fully answer because I don't have all the background in terms of Whitebird and their funding sources. What I can say is that at the county we do fund similar services and a number of organizations doing work that is related to street outreach and the provision of basic needs for individuals who are unhoused and or in poverty. So we have, as a county, we have processes for allocating those funds, which involve a competitive, basically bidding process, what we call a request for proposal or an RFP, and individuals will come to us and we will fund those services. Whitebird services were funded in a different way, and I don't have all of the details behind how that happened. We certainly are advocating very hard at the state as well as the federal level for as many resources as we can have to take care of the people with the highest needs in our community. I will say that projecting forward, what we will have available coming from us federally is likely to decline. I think everyone in this room knows that. But the state is very invested in this work. Governor Kotek is very invested in this work, and so we have hope that we will be able to recoup at least some of that from state investments to continue to provide for the basic needs of people while they're unhoused, but more importantly, get housing built and get people off the street and indoors.
I did get one question from the audience around mental health stigma. Can you talk about if you've encountered any pushback from the community about building these types of facilities? And then also, like, what can we do, or what do you think people should do to counter this stigma?
You know, I think every time we build a facility like this, there are concerns that people bring forward. When the facility will be a part of their neighborhood. They wonder how that facility might change their neighborhood or the character of their neighborhood. And I think that's something that we expect when we are working through these projects. And we continue to work really hard to point to the models that exist elsewhere in the nation, that these models are providing people with good treatment so that they're not just released onto the street in a neighborhood without what they need. So again, trying to focus on what we've seen from elsewhere, knowing that the unknown often brings fear, and trying to be present and local residents of communities so that they can feel more comfortable with the facility and what it will be as a part of their neighborhood. Do you want to add to that?
Yeah, I would add, one thing is, and I can say this for Peace Health, and I also have seen this in our partnership with Lane County and also working with them for so many years. We're good neighbors, Peace Health is. We did have at University District, our inpatient behavioral health unit is still there. We see literally college kids who walk right across our parking lot within feet, looking at their cell phones, not even knowing that there's an inpatient unit within feet of them. And we really, our commitment is to provide safe care to our patients and also safe care in making sure that our staff, our visitors, and our community are safe. And so that's really what we will do when we build this hospital. We'll have the same, those are our values, and our intent is to continue that practice when we open our facilities. So I think that's what we can put out there, and we continue to say. We have not had any incidents involving any visitors or concerns like that in our units, or even when we had our emergency department at University District as a result of a safety issue. And so how can you get the word out? We would appreciate that. We do have a couple different ways. We've got websites out there that Eve's talked about, and then we also have a Lane Behavioral Health Campus model, and really look forward to opportunities to write letters to represented officials, just talking about how this campus model will impact you or the loved ones or our community would be really greatly appreciated.
This concludes our Q&A for today. Thank you so much to Alicia and Eve.
Great, thank you.
This has been our February 21st, 2025 conversation at the City Club of Eugene. You might have seen in our newsletter this week that there is a survey out there about the future of the Lane County Fairgrounds. If you hadn't had the chance to take a few minutes to fill that out, please do so. It really will provide the county with lots of things to think about, and we will follow up here at City Club in the coming months with a forum on the future of the fairgrounds. Next week, we will dive into the state of electronic media in Eugene with a panel of local journalists. That'll be a fun one. Have a great weekend. See you soon.